Lower eyelid surgery can be done in a number of ways. It really depends what the patient needs in terms of what we pick as a procedure. A patient can present with just bulging in the lower eyelid area, and that can be treated by removing fat from the lower eyelid area with an incision hidden on the inside of the eyelid. In a patient who has excess skin, the skin can be removed with an incision, but that incision is on the outside, usually underneath the eyelash line. In patients who have extra fat and extra skin, that can be done with a single incision from the outside or with an incision from the inside to remove the fat and an incision on the outside to remove the extra skin. And again, it depends on the physical exam of the patient in terms of what procedure is selected. In patients who have a significant amount of laxity of the lower eyelid, a surgeon may choose to do two incisions where excess fat is removed from the inside of the eyelid, but they do what's called a pinch skin excision and a small amount of skin is removed from the outside. This prevents further weakening of the lower lid mechanism. When a patient has laxity of their lower eyelid, the lid doesn't snap back to the eye very quickly. We don't want to exacerbate the problem with laxity of the lower eyelid because in these patients, the result could be an ectropion, which is when the lower eyelid is pulled down and held down. An ectropion can happen after lower eyelid surgery when there is an incision on the outside. This can be treated by regular massage, where a patient will hold their eyelid up and hold it in a stretched position a few times a day and then release it. Another exercise a patient can do is try to squint their lower eyelid area, and this will activate the orbicularis muscle, which is the muscle that gets stunned while performing lower lid surgery. So by performing those animations, that muscle can reactivate. Again, massage is the most important thing when you develop a ectropion after lower eyelid surgery.